Hi, everyone. I'm Juliana Castellanos. I'm going to be presenting today a little bit about my experience in what it's been for me navigating the healthcare system and the education system here in the US. I'm going to start saying that as you see, I have my MD and MPH. I'm not certified yet with the license process. I have the IMGs as me about having my MD on the side of my name when I don't have my license, and I'm going to tell you a little bit of why I do it, and it's because I went to a couple of international conferences, and I learned that our medical degree doesn't have a border. Like everyone, when it's in an international conference, everyone keeps their MD, and I realized that the medical degree it's our degree, and we shouldn't have to remove it of our names. I'm saying this because in my first job in the US, I was asked to remove it off my name, and it took me like 9 months to put it back. So I introduced myself as a physician without a license, but I'm still an MD. And I'm in this moment doing an MPH, so I'm a MD MPH candidate. Please feel free to interrupt anytime if you have questions. I'm going to say a little bit about how I got to the US. I came here in 2020. I quit my job to travel in Central America. So I have three potential plans: my plan A, my plan B, and plan C. My plan A was to travel. My plan B was, in the middle of my travels, apply to Doctors Without Borders. And my plan C was to come back to Colombia. Unfortunately, COVID started that same year, and I couldn't continue my trips in Central America. I applied to Doctors Without Borders, but when I received their notification, they changed priorities, and they didn't have the position that I was applying anymore. And my plan C, that was to come back to Colombia. Colombia closed the borders because of COVID, so I couldn't come back to my country either. So it was a little bit difficult for me, and I think I'm a little bit different of many of cases because I didn't come here to say I have to stay like destiny basically wanted me here, I think. Some of the key determinants of everything that I'm going to be speaking it's based on this legal status and your location of things, but I think all of them have pros and cons. So I'm going to speak a little bit about it accordingly with my experience. So for the legal status, we have a student visa, green card, and citizenship, and a work visa. The work visa, I'm not going to talk too much about it because to get a work visa, or you have to be an expert on the topic, or you have to find a company that is willing to sponsor you. And for that, you have to have any type of talent or experience in what I know. And location within the US, there are some states that are IMG friendly, and I think we all have heard that accordingly with the match for the residency. But I think I believe that they are IMG friendly just because of how many internationals are in their communities. I'm in Missouri. In Missouri, there is very few diversity here. So Missouri is not IMG friendly. Illinois, that it's next to Missouri, it's still Midwest, but it's where Chicago is, and they have a higher volume of international. So that makes it easier not only for the match, because if there are many internationals in the community, I think they perceive us different and they give more value to our experiences. Yeah. So a little bit about what happened at the beginning. I told you that I got stuck here in the US. So I came with a tourist visa. The tourist visa was only for 6 months, so I then have to apply for an extension of my visa, and that left me with no status. I had no status, and that reduced my options. I couldn't work legally, I couldn't do many things, right? So the one day I decided that I wanted to do the steps, I was sleeping in my brother's couch in New Jersey, and decided I wasn't doing anything. Like basically, I was just waiting to see when I was I just started to study at the interest and just fully marking 12 hours and then figured it out what's wrong with my life. So I was studying probably only 5 hours per week. I wasn't studying too much. There's a lot of effort, mental effort, emotional effort, time effort. We know that it's expensive. And I think it's important that it's important to be in the right mindset, but it's also difficult with everything that is going on around life, in life. After after I was in New Jersey, I came to Missouri to visit a friend. I ended up staying a little bit longer of what I thought, and I started to work cleaning an Airbnb. So my mental health in that moment, like it was very, very like for all the effort that it required, it's important to at least have some stability mental, like in your mental health. And in that moment, like for me, it was very hard to come, get stuck, then work as waitress, then work as cleaning. So I know the day, but the reality was sitting in front of the computer trying to find options for me. And so I was studying probably 5 to 10 hours per week. I wasn't studying too much. I have a picture of the mountains there because I found volunteering for volunteers during COVID. So that's what I was doing when I didn't have a legal status, because with no status, you cannot work, you cannot travel, you cannot study, you cannot do too many things. Some of the difficulties, once that you stay here or once that you decide to stay here, I think it's important to speak about what they call the cultural clash. This became more relevant later in my process here, but I think it's important that we speak about it because I honestly didn't know. I didn't know that, and that's important in what location you are within the US, because if you are in a city, it's different the way that you live. Here, I speak Spanish. It's my first language. Here, I barely speak Spanish because there are not many Hispanic people here. And once that you live your country, you live your culture, you live your music, your food, those things become more important to find here. So it's important that we find groups of people, of other immigrants, that we ask for help when it's needed, and that we do a lot of networking, like put ourselves out in the world, because the opportunities don't come to our house. We have to go and find them. And if some of you don't feel comfortable with your level of English, because at the beginning, 5 years ago, I didn't speak English, so I wasn't comfortable to go and find networking, friends, opportunities when I didn't speak the language. So I basically had to focus in improving my language, my language skills socially first, to then do it professionally. So all of that just to say that once that you are independently where you are from and what is legal is independent, it's going to be difficult. And from that we would not mean for here where Kaplan, it's an option. Kaplan helps people to get a student visa. When I was looking for Kaplan, they have a location in Chicago, another one in New York, and another one in Houston. And I could apply to get a change. I don't remember exactly, that was a while ago, but I think it was more than $10,000 only to study. And I wasn't in those cities, so I had to relocate, I had to find housing, food, and all of that. So it wasn't an option for me because it was a little bit out of my budget, I guess. The other thing that I tried to do was community college, and the programs of ESL, that is English as a second language. Those programs, some of them in community college also can help you to change your visa to a student visa, that it will be an H-1B visa. And community college, it's you can also get a work visa, but the level of studies of a community college are going to be a little bit more basic of what I wanted to do in the moment. So I didn't pursue that. Something else that I was doing, because in the middle of me trying to figure out all of this, I miss a lot the contact with patients. I miss the community. I miss all of that. I was trying to do volunteerings, and I find the Red Cross. The Red Cross, you don't need a legal status to do volunteerings. And I was volunteering linking families that lost connection with when they have to forcibly move to the US, but like refugees, asylum, of people that were in with those status. They've lost connections with their families, and I was helping them to connect. So that was my volunteer with the Red Cross. And it's when I start to feel a little bit more useful, I guess, because I didn't feel that I was feeling so useful just sitting in my computer and studying, and this helped me to just balance and get to know the community. I went to places that I wouldn't have gone with my friends or family, just because it was like just getting more involved in the community. So after 1 year of being here, and after trying to change my visa to student visa, after trying many things, we decided to get married with my now husband. So that was going to change a lot of things. But when you get married, there are many other things that are not under our control in deciding how to handle this. I think I'm saying this because it's relevant for, like, for example, if you want to continue your education, like assistance with your studies, these play a role there. So that's the reason I'm saying it. But once that we decided to get married, it took around, so we got married, and it took probably 1 year and 2 months to 6 months to get my work permit. And in those 6 months, I was volunteering in a laboratory. But it took me like 1 year and 2 months to find my first job in the US after that. What are our options here in the US without a license and with a legal status that allow us to work? So one of my recommendations is that my first challenge was to understand the healthcare system, because it was completely different than Colombian's healthcare system. So I didn't know where. First of all, I didn't understand the healthcare system. Second of all, I didn't know what could I do as a physician without a license here in the country. Most of the people say nothing, or research, or other type of jobs that are not related to healthcare. It's what I heard before coming. So I started to, I started to learn about the system. I also started to connect with other healthcare workers independently of like what they were doing, just for me to practice my English, practice my social skills, get to know people, that people in the area start to get to know me. So that's from San Luis, I'm in San Luis. So they have SLU University, San Luis University, and Washington University. Those two are pretty good. Like Washington University, I think it's in the position number 12 in medicine in the country. And they have a great research team there. So when I start to find the laboratories, because people told me that I only could do research, and I had no experience in research before. So I just started to find all the universities and all the laboratories, and I started to reach out to all of them and sending emails saying that I wanted to volunteer, that I didn't have a legal status in the country, that I couldn't legally work, but I wanted to volunteer or do something. I sent probably 50 emails. Only one person answered saying, say something else. What are you capable of, and what can you do? I had no experience in research, so I don't remember what I answered, but I'm sure I didn't get it because I had no idea what I was saying. So I had to do informational interviews, and I'm going to do speak a lot at the end about it. The information interviews, they have a specific structure. So after I reached out to the laboratories, I had a friend of a friend that was a researcher. He was a PhD candidate in Washington University. And he let me volunteer with him. So basically, I was doing cancer research for 1 year with no pay. I put as many hours as 30 hours. And I think it was a very cool experience for me. Like, I think for me it was ideal. I was still studying, but clean was doing it. That's what I wanted at the time. So I think I finally started to feel, okay, I have something to here. Did for a little bit after actual work permit. I met with the PI, with the principal investigator of the laboratory. They were going to offer me a job, but research is not for me. Like, this type of research is not for me because I'm too much of a people person. So I went to the interview to say, no, thank you. I appreciate it. And they offered me a letter saying that I was there volunteering for all this time. What I think it was the best outcome of that time there. After that, I spent probably 6 months trying to find a job, and I thought it was a mistake for me to reject a job when I didn't have one, but I really wanted to work in the community. I applied to some jobs that I'm going to speak later, what type of job we can get. And I ended up getting a job in a company for, they were immigrants, both of them, the owners. And they were basically 60% of their staff was immigrant, and that made a big difference because when I went to that interview, I was just learning how to drive, and I had a problem with my car, and I think I took the highway by mistake, and I went late to my interview more than 35 minutes. And I think, like, if they wouldn't have been immigrants, I wouldn't have gotten that job because they were super empathetic and understanding with my situation. They knew I didn't know how to drive. So that make a big difference. They are a small manufacturing company here in St. Louis, but they have 2 FDA approved medicines, and they were going for the tier 1 and 4 one. And I was doing research and development. That's another position that many pharmaceuticals have it. If you have experience in research, if pharmaceuticals is something that you have interest, that's something that I think it would be very good. It's a well-paid pharmaceutical. An option for pharmaceuticals is the medical liaison. They basically, it's a little bit of sales for the pharmaceuticals, but they need medical knowledge, and they go to just promote new medicines to healthcare workers. These are the potential options that I was looking for in when I was working, when I was trying to find a job with them. It's important that after, like, I said that after I get I rejected the position in the laboratory, I realized I had no idea how to sell myself. I know what, in case do patient care. That's what I was thinking. The beginning, they tell you have to find the skills that they have in the job description. You have to do that. And I was like, but I don't even have a job description because I don't know what job I can do. So it's important to understand what are our soft skills and our hard skills, because depending on that, how we are going to sell ourselves and how other people are going to see us are capable of. So I invite you to do kind to what skills, soft understand skills, and don't undersell yourself, like don't underqualify yourself. Like, we as physicians that have clinical experience, we can have leadership positions. We can. I don't remember exactly how it fit me, but I led just to not qualify. So I'm saying that some of the solutions here. So I got my first job in public health, that it was directing an HIV/STI prevention program in a federal qualified health center. And I was in that position for 2 years. I lost the position for everything that is happening in the country. I lost the position at the beginning of 1 month ago, I think so. Yeah, like almost 2 months ago, I lost my position. So to find jobs in public, your skills, and you understand a little bit of what you want to do. Like, I'm sure that many people will have done many things to have the job that I had in the laboratory, but it wasn't for me. So once that you understand what you really want to do in the meantime while you're preparing for your steps, I think that will make a difference. I did a step 1 just to correlate that part. I did a step 1 in my first year. And again, I wasn't in a good mental state. I shouldn't even have done that when I was working with this job. And I was working a 9 to 5, and I was studying a lot. It was difficult. I postponed it a couple of times. I think I should I only studied for probably 3 months. I could have done it a little bit longer. I didn't pass again, and I decided to keep it on hold for a little bit because it was very difficult and demanding in time when I was in a 9 to 5 and then just studying. My recommendation to have find a job in public health, it's going to be that find places like federal qualified health centers, that those are just health centers that are key to connect low resources settings, low resources communities with healthcare services. So they are going to be more flexible, value to our skills. So federal qualified health centers, local hospitals, nonprofits, and health departments will absolutely hire someone that is a physician and it doesn't have a license to do a public health job. What type of jobs? Something that I didn't know, it was the fact that the system works different, because many of the positions that I'm going to mention, we don't have them in my country. I didn't know what to do. So these positions are case managers, community health workers, disease intervention specialist, patient navigator. Those 4 positions are paid around $50,000. And it's basically, you will be the middle person between the clinical team and your patient, and you will be the person, because here the way they structure is that they don't have providers don't have too much time, so they want still to take care of the patient. So for example, a community health worker, let's say I'm a person living with HIV and I need my treatment, but I also need housing, I also need food, I also need dental appointments, I also need mental health, behavioral health. So the community health worker will be the person that will help me to connect with all of that. Community health workers also, for example, help with, they learn the resources in their community. And if, for example, someone needs assistance to pay their utilities bill, they will help them to connect with those resources. So it's again, those positions pay around between $40,000 to $50,000. Patient navigator and disease intervention specialist. For example, if I was diagnosed with HIV, they report this to the health department, and the healthcare department's one person of the healthcare department will reach out to me to say, we need to know what are your sexual health, what food they have, that I could have transmitted infection. They do like investigation to find all these contacts, and that's what a disease intervention specialist does. And they get paid probably between $45,000 and $65,000. If another recommendation is that if you have a university close to you, or even do online, do a certificates in program evaluation, program management. I think those 2 will be very helpful, program management and program evaluation, and that will help you more tools to be coordinator or director. I didn't have the certificates. I got the job, but I'm going to be honest. Sorry, exactly what I was. But of course, I learned, and there are guidelines to do everything. Doing, because I learned a lot of what I was doing when I was doing. Other clinical jobs that are possible to get, but this requires certifications, are physician assistant, nurse practitioner, and nurse. Those are basically like coming back to school and doing 3 to 4 years program. Those get better paid. A physician assistant, they are basically general practitioners. They are doing the same that a general practitioner does in my country, but they study. And those positions are going to get paid above. The technicians that only require you a certificate of a couple of months, 3 to 4 months, $40,000 to $50,000 with these positions. But the certification will be shorter. I'm doing my MPH online in Johns Hopkins. Some of the like the requirements, for example, the requirements are the same for everyone when it's online. If it's online, I've been studying with people that are there in different countries, and they are the university gives also resources for them to find how to pay the university. And if you have, well, in their own countries, they also have a financial aid. They wouldn't need an H-1B visa. If you want to do an MPH in person, you will need an H-1B visa. In this moment, like, it's very difficult for the universities to be doing those visas for all the problems that are happening with the presidential administration. So I can share some of the updates that Johns Hopkins is giving for international students, if someone is interested. But basically what I have here are the requirements. As we see, it's not like, basically we will easily get some of these requirements because just being a doctor, it already give us half of them, basically. They require 2 to 3 recommendation letters. I think it's 2 academic and 1 professional. And there are more online programs. I believe they also have the doctorate for public health. They also have, I don't remember what other one, but I didn't apply to the doctorate in public health because I didn't have one of the requirements. It was more experience in public health, so I didn't apply for that one because I didn't have the requirements. But if someone has experience in public health for more than 3 years, you will be able to apply to the online doctorate in public health too. From the jobs that I was mentioning with public health and the clinical jobs, those positions definitely require. Many of them are not going to do it. The H-1B visa, basically, no, the work visa. Many people can get a work visa, but it's depending on the place that you are going. And what I've seen in my experience is if you are an expert in a topic, or if you have, for example, if you're an IMG that it's, let's say, general practitioner at OBGYN with 10 years of experience as OBGYN, like, I think that would be easier, like, to find someone that is willing to give you a work visa, let's say in research of something with women's health. That would be more likely. But if for someone that I only had 4 years of clinical experience, getting a work visa was almost impossible to even think about it. And to finalize, this is the informational interviews information. Like, basically, they have a structure, and I think it's important because most of the jobs that I got here is for people that I get to know someone. And if I wouldn't have done this structure, I wouldn't have connected with that people in the same way. Basically, it's like, for example, I saw someone on LinkedIn that it's an MD MPH, and I wanted to do my MPH. So I reached out to that person in LinkedIn. I said, hey, how are you? I really have an interest on learning in your career as MD MPH. Would you be down to sit with me for 15, 20 minutes to ask you a couple of questions? Most of the people say yes. The purpose of this is not to find a job, because if you go with that intention, like, people are really not going to be open with you. If you go with the intention of getting to know them, them getting to know you, you are going to probably get more from them. And so after I experience what have you done, what type of jobs you can get, or whatever, them, not about you. If they ask you questions about you, that's great, but you have to show interest on them. And then, like, well, you finish the interview and you have to follow up. This is extremely important, and they never follow up. And it's like, I offered to someone the option, to another IMG, the option to do volunteer work in my team, and she never follow up. I follow up with her, and she was always waiting for me to follow up. And I'm like we have to show interest. Like we cannot wait for the other person to just be chasing us for them to give us an opportunity. So it's important to follow up. And I think that's it. If someone else has questions, please let me know. Thank you so much for listening.
Okay, thank you, Juliana, for the presentation. Hello, doctors. Are we here? Are we together?
Yep.
Hello? Okay, you can drop your questions in the chat, or you can raise up your hand, or feel free to unmute your mics if you have any questions. Hello? Thank you, Aura.
I just saw your message that you didn't hear me well sometimes.
Yeah,
sorry for that.
At some point we could not hear you. Yes. Najib, do you have any questions? Aura, and some doctors were trying to get on the call, but they were not able to connect. Okay, we have one question. Is the MPH a 2-year program?
It's self-paced. Basically, we have 4 years to finish, because if you have a 9 to 5, the program, it's 80 credits. Each credit, it's around $1,000, like $1,300 each credit, and it's 80 credits. So they recommend that if you have a 9 to 5, they recommend to only do 6 credits. And if we do 6 credits, it takes around 3 years to finish the program. In this moment that I'm not working, I'm doing 15 credits. So I'm hoping to, while I find a job in this moment, I'm hoping to finish in probably 1 year. So it's self-paced. It's the time that it takes you, but they recommend to do it slow, because sometimes it becomes a lot. And also, like, I'm finding a job in this moment, and I'm doing everything that I said. I have my list. I have a spreadsheet with the people that I want to reach out. I'm doing connections. I'm doing networking, because because the situation is so bad in public health in this moment, and specifically with what I was working, and my MPH is focusing infectious diseases and global health. I'm connected with global health, aiming to find something, or an international organization, or an international job, or something that is related with international, because the situation is a little bit difficult in this moment. Thank you, Aura.
Oh, hi there. I have a question. I guess a lot of our people are ECFMG certified already. Some of them have passed step 3 as well. I was wondering if this webinar had something to guide those individuals who didn't match into residency programs, like me. Like I have, I'm ECFMG certified. I took my step 3. It's been like 6 years I have been unmatched. So I was looking forward to hear from you guys some options about the unmatched graduates. Do you have any information on that, or really you don't know much about that topic?
I don't know too much about the topic, but I had a conversation with someone that it's in the same situation than you. She had the ACFMG certificate, and it's been probably 10 years for her. And I think she hasn't matched either, but I think what she's told me in her experience is just she's working in public health, she's working in something else while she wants to try again. So she's just basically, she work in a pharmaceutical, she's just finding jobs in some of the places that I mentioned while she continue trying to do the match.
Okay, because I have I'm sorry, I have a license as an assistant physician in the state of Missouri, And I was in Texas, and I was recently offered a job. I've worked there before, but I heard about a lot of other options opening up for IMGs like me, especially in the state of Washington, Massachusetts, and Illinois. Like these are called alternate pathways, which are like a different route other than getting into the residency. So yeah, I mean, if you're ECFMG certified, you have other options to work as an assistant physician. You need some experience, and there are better chances for you to get into the match too. So yeah, I would like to highlight that if nobody knows about that program.
I think I've heard of some of those cases, but I don't know. I know that there are probably 3 states in this moment that are having that pathway that you are mentioning about, like IMGs that are certified to work under supervision of another doctor for a while, and that opens the door for the match. That's what I've heard too, but I don't have experience with that information.
Okay, thank you. Thank you so much.
So do we have any other questions? Hello guys, feel free to ask your questions. Okay, if we do not have any more questions, thank you very much everyone once again for joining the meeting. And thank you also to Juliana for making out the time to treat this subject as it affects many IMGs, and we're really glad to have you. And we look forward to many more webinars that you'll be able to share your experience and guide more IMGs as well. So that will be all for now, and we'll let everyone know the next time that we'll have Juliana or someone else to educate us on ways to better ourselves as IMGs. So thank you all for coming on this call, and do enjoy the rest of your day.
Thank you. Bye.
Yeah, thank you.